Welcome to Side Effects with an A. When effect is normally used, it's a noun. It's already occurred.
Effect is a verb meaning action. Action influences outcomes.
I'm Scott McGohan.
And I'm Anne-Marie Singleton. We will provoke you to think differently.
Side Effects, where problems are defined, solutions exposed. Welcome to Side Effects. I'm Scott McGohan.
And I'm Anne-Marie Singleton.
We've got an amazing guest with us here today. The fountain of knowledge, as I refer to him. Grant Reed, thanks for being here.
Thank you. It's my pleasure.
So you've been with McGohan Brabender for a long time. We're really grateful for all your support, but also you've got a long track record in regards to expertise in this industry. So where did you start your career?
I started my career actually on January 6, 1975.
Grant's not very exact. So.
Yeah. It was a Monday. And so this coming January, it'll be my 43rd year in this business.
Wow.
Yeah.
Well, one of the things we want to do is there's a sense of urgency in regards to the Affordable Care Act and this most recent executive order.
Yes.
And there's a lot of questions that people have.
Yes.
What does this mean? And
what should we do?
Exactly.
Right?
Yes. Yes. What's interesting about this is this kind of came from left field, the actual wording in the executive order. And we do have the executive order. I understand we'll be uploading it to our site for people to download if they'd like to read it. But there had been a lot of talk in really several months up to this executive order talking about selling across state lines. And
right.
As an underwriter, right away I'm starting to yell at the television saying simply selling across state lines won't do anything. Because if I'm an insurer that doesn't have business in Indiana, let's say, and I decide that because I can sell across state lines, I'm going to go to Indiana and sell a product, my pricing is going to be so much higher than everyone else because I don't have a discount.
Right.
If I'm able to get a discount, then maybe I can compete. But simply selling across state lines is not the answer.
Because the carrier needs a relationship with the health systems in order to offer a competitive rate and product.
That's exactly right.
Right.
There were some people that clearly didn't understand the direction they were going that talked about the different mandates within the states. And the National Association of Insurance Commissioners came out just a few weeks ago and said they looked at the cost of all these mandates across all the states, and the variation is only at most 5%. So that's certainly not going to open up a market for you by
You know what's
saving
interesting?
5%.
You bring that up, and I know we're going to talk about the executive order, but you talk about the funding that we spend in this country on co-ops.
Yes.
Right?
Mm-hmm.
That was part of the original.
Exactly. And
Original
the
ASIC.
majority of them are gone.
That's correct.
They did not survive.
Very quickly they went away.
But quickly, your reference point is the fact that they didn't have the pricing model in the markets in which they were doing business.
That's correct.
So you and I, if we were going to buy water, we would assume that the price for water in Indiana is similar as it is in Dayton. It's close.
It's close, yes.
Healthcare just defies all laws of economics.
That's correct.
And so when we hear selling across state lines, the public hears, wow, that's great.
Competition, right.
I'm the skeptic, and I'm like, that's just unfortunately a deceptive way to put hope in the American people that healthcare costs is going to become lower, because it's just not.
Well, even if they were to overcome, they being the insurance companies, were able to overcome that network discount.
Right.
Let's look at the profits that the insurance companies make. There's been all kinds of talk this week about the $17 billion that they've made so far this year. Well, they have $1 trillion of exposure. So that's only about 1.7%. That's a very narrow profit margin. And if you withhold these cost-sharing reduction payments, that's $7 billion. That's going to eat away a lot of the profit they've made. I don't know about you, but I would like my insurance company to have money to pay my claims.
Right.
That would certainly be good. I don't want them to be excessive, but there's already provisions in there that control how much profit they can make.
Through the MLR.
Yes, through the loss ratio. So we're already controlling it that way. This just tells me, though, they're not making a lot of money on other coverages in addition to the hundreds of millions of dollars that they've lost on the marketplace.
Right, and so the cost sharing that you're talking about has to do with the subsidies and the amounts that are available for people through the exchange. exchanges.
Yes, if I have income less than 250% of the federal poverty level, and I buy a silver plan,
Right.
that will give me effectively a lower deductible, lower out of pocket, just based on these cost sharing reductions.
Right.
So it enabled me to have better coverage for a better price.
Right.
It evaporates once you get to 250% of the federal poverty level. But what happened? This executive order, we got just a few days ahead of time, people started talking about it was going to make a change to ERISA. Now, ERISA, I am a child of ERISA. I started in 1975. ERISA was signed in September 1974.
Okay.
One of the first tasks I was given when I came into, it was Medical Mutual of Cleveland at the time. They said, figure this ERISA stuff out. We had no self-funded clients, so it really didn't apply to us. But it gave me a chance to get in and read the pages of the law and try and understand what it was they were doing. And they were recognizing that you have these corporations that are really conglomerates of businesses that cross state lines. And those were the leaders in self-insurance.
Right.
So it said these corporations, they called them control groups, are really one corporation for the purpose of ERISA.
Mm-hmm.
So you had, like 150, 500 to file, different things like that, and you were allowed to sell or to purchase coverage across state lines since you were one employer.
Right. But in the state in which they were housed, right?
Yes. What this does, what this executive order does, is it comes in and says, well, we're going to also call association health plans as a corporation. We're going to include it under that, which would give you then the ability for a small group and an individual to join together and make a large corporation and be recognized under ERISA. Now, the devil's in the details, as I mentioned before. 60 days the president has given them to come up with the regulations that will apply to this. And this is very critical over whether or not this is going to be a success or a failure. The reason the Affordable Care Act has failed is the regulations dip into the underwriting regulations that the carriers do.
Right.
You have to have a balance of the risk that you're bringing into this. And frankly, there's a couple of things specifically that are within the ACA that have caused that balance not to happen.
Yeah.
Most of the people that are signing up for the marketplace are in the 55 plus age category. We're not attracting the people that are very young.
Right, so we're getting poor risk.
You know what the one age is that has the most people alive in the United States right now? 26. That's one of the lowest categories of people signing up for the ACA.
Yeah.
So we're not bringing those people in. The reason is their prices are so much higher than it used to be. And when they look at what the cost is, they say it's not a good value. I'm going to go ahead and pay the penalty if indeed it even applies to me, because it's still kind of hard to get a job as a young person, so you may not have a good paying job, and you've got a waiver, and so you don't even have to pay the tax penalty. So you've got, the key things are, someone in writing the law thought it was discriminatory that we would charge more for a female than a male. Well, it just happens that it is more expensive for a female than a male.
Sure, especially during childbearing years. Right?
Yes, and really it's not as much related to childbearing, it's the fact that there's a female reproductive system. And there's so many more issues that arise with that than it does within the male.
Right.
They also had this notion that,
Hey, last time I checked, I think my insurance when I was 18 was a heck of a lot more than my sister's. Car insurance.
Oh,
car
insurance.
insurance. Well, okay.
Well, that's different. That's a different set of statistics.
But that's discriminatory, Scott. You shouldn't allow that.
By golly.
But the other thing is this whole notion of age bands. The authors of the law thought if they narrowed them from, carriers traditionally went 8 to 1, 10 to 1.
Right.
If they narrowed it to 3 to 1, that these costs would meet in the middle. That's not what happened at all.
You still need the same dollar amount to insure the same set of people.
Exactly right. And the law of large numbers is all about a lot of people paying for a few people. And when they compressed these ranges, what they did was they brought the higher age ranges down just a little bit. But those lower age ranges had to come way up to meet them.
Right.
So that's what pushed the cost up for the younger people. Those are the people that come to the table without any claims, and that caused it to fail because the young people said, I'm not going to pay $250 a month for coverage that I'm not going to use.
Right.
I mean, it's a bargain.
I'll just pay when I go to the doctor.
You can pay almost, in Montgomery County, for a bronze plan, you can pay almost $250 a month or almost $3,000 a year, and for that you get a $7,150 deductible.
Yeah.
So you have to have almost $10,000 in claims for that to pay off.
Right.
Yeah, so
Just
and prior to
doesn't make
that,
sense
so if
for
I'm
them.
62, my rate might have been, pick a number, $900. And a 26-year-old might have been, a male would be $80, female might have been $300.
Yep.
So what happened is now that 26-year-old's premium is, $300 or $400.
Correct.
Right.
That 62-year-old is now $700. And the young people just jumped out of the pool and yelled, fish out of water.
Right.
That's correct.
So we just
Yeah.
filled this pool.
It's
Yes.
just adverse selection at
Well,
its
and many of them
finest.
too went on their parents' plan,
Because they could.
which I've heard people say that's free. Well, it's not free. Do you know what a 25-year-old costs on average? This is data out of our data analytics system. $2,648 a year. That's not free.
Right.
That's shifting the cost onto the employer. So many employers have borne that cost, and it continues to drive up the cost for our groups.
You said this came out of sort of left field, and we had
Yes.
been hearing that not much was going to happen after, there was the whole situation where it didn't go to a vote, and then the focus was other places, and
Mm-hmm.
everything seemed to be fairly quiet. And then we get this executive order that's 2 pages and a quarter or something.
Yes.
It's fairly short.
Yeah.
So what do you think led up to this? Why it came out of the
Well, it's clearly
seemingly blue?
Senator Rand Paul's idea. He had been talking about it. He'd been talking about it again in terms of simply selling across state lines being the end all. What this does, though, is this changes ERISA to allow small groups and individuals to join together to form a corporation under ERISA if they do not put any regulations in that restrict the underwriting. What this does, other than the fines and penalties, is that it repeals the Affordable Care Act, because every insurer will abandon the marketplace and they'll move over and they'll have these association health plans. The other thing it does is we had these short-term limited duration policies
right.
that were in existence, and the Obama administration, shortly before the
eliminated
end,
those.
they shrunk the time down that you could have these. That's an excellent alternative to this, especially if you're kind of bridging the gap. If you could have it up to a year.
Right.
You don't need this comprehensive coverage maybe. You're still contributing something to the pool. And that's what we need, is we need more
And
people
this
to be in
reintroduces
the
those
pool.
short-term plans.
Yes, it does.
Yeah.
The other part of that is the health reimbursement arrangements. Using those to actually, you can give them to your employees, and they can use that to purchase coverage on their own. If they do not put any regulations on underwriting in these association health plans, what it will do is allow the insurers to go back out and return to their pre-ACA pricing. That would apply to the individuals, that would apply to the small groups. I mean, when the small groups get into the ACA rates, it's horrible. We run set
not
tests all the
competitive.
time. It doubles their rates right off the bat because of the compression of the age ranges primarily. So if they don't do that, that repeals that. We have to get rid of the fines and penalties somehow.
Right.
But nobody will be offering insurance in the marketplace.
So you said you've been with ERISA since the beginning.
Yes.
And really, I've been in this industry 11 years, so not quite as long as you. But there hasn't been very many changes to the ERISA law over time, has there?
Well, you had COBRA,
Yeah.
HIPAA,
Yeah.
those were extensions.
But
You had the
those
Women's
were,
Health Care Act, that was part of that, but nothing major. I mean, COBRA
Right.
and HIPAA were for specific things, around portability of coverage, trying to get away from pre-existing conditions, which is another thing that I hope this doesn't address. If it allows carriers to adjust rates for pre-existing conditions, that's another important part of that.
So really, the crux of this is, prior to 2010, our healthcare system was an epic mess. In regards to cost.
We had an uninsured problem, and no, I would contend that it wasn't, not compared to now. We've got many states where, with this most recent rate change, the rates have quadrupled since the Affordable Care Act went into place. A 22-year-old person male could buy coverage for $75 a month.
Sure.
And it was a PPO plan. It offered very good coverage. Well, now the whole system has been pulled up. I mean, yes, we have a lot of older people that have signed up for the plan, but we still don't have the healthy ones that have
Right.
signed up for
Which
the
is the
marketplace.
whole premise
Right.
of insurance.
So it's
Right.
driving
Right.
that cost up and up. What this would do, if there's no underwriting regulations being impacted here, it would put us back to March 22nd, 2010.
Right.
There we would have this spread of rates, maybe 8-to-1. We would have males that are paying less than females at certain ages. It crosses once you get into your 50s.
Yeah.
And that wide range of rates would make the coverage more affordable for a lot of the people that are staying out of the plan. But what that does is that puts us back to where we have that pool of people that are uninsured, and
Right.
what do we do
What do
with
we
them?
But when when you talk about that, I mean, one is pre-existing conditions is a big deal. And
Yes, it is.
that scares people to death.
Yes.
And my personal opinion is prior to 2010, I think it was very disappointing that this country had a healthcare system that people, when they needed it, couldn't get it. I just think it was wrong. So did they address it in the right way financially, this country? The answer is no.
No.
Absolutely
Right.
not.
Right.
No.
However, the future of this, so I think the premise that everybody wants is they want to keep what they have, but they want it to be less, and they want better quality, and they want better access. And
Yes.
the truth is, the answer to that is no, no. So in order to change this, it is going to be significantly disruptive.
Yes.
But what this would allow our country to experience is you would have carriers, so the Anthems, the Uniteds, the Aetnas, the Cignas, other carriers come back into the individual market,
Yes.
come back into the employer market.
Mhm.
They wouldn't be shackled with the metallic plans, which
That's
destroys
Yeah.
a strategy for an employer.
Right.
Mhm.
And it would probably drive additional competition back up into the individual market.
And we
Yeah.
would see lower costs
Right.
because we would get more people joining the pool.
You know, and you said something, Scott, people want to keep what they have, and I think that you meant globally people, you know, want to have their PPO plan or what have you, but I would say that most employers in this region don't want to keep what they have. They want something better because they've had to go to plans that they don't feel like are offering the type of coverage that they want to their workforce. Most of them are at a high deductible plan. Many of them have a 60% plan as their plan because that's what they can afford.
Yeah, I think one of the things too, Grant, is when you look at this, so obviously you had, I don't care if you're left or right, you had the left, now you have the right, and nobody wants to touch this with a 10-foot pole. But this is a Jenga tower. I mean, this thing's going to topple,
Yes.
whether you like it or not.
Yes.
It's just a matter of time.
Yes. Yeah, we know.
And so here's my opinion. Doing nothing is a terrible option. Terrible option.
Right.
Just
You're right.
leaving it alone.
Mhm.
Because do you pay taxes?
Yes.
Last time I checked, I do.
Yes.
Yeah,
You pay
yes,
taxes?
I do. I do.
Yeah, I mean, we
I
all
don't
do. I mean,
want
so
to, but I
so
do.
we're all paying for this.
Mhm.
We're paying for this,
Yes, we are.
and we're better than this,
Yes.
and we can make significant changes. So, what's the likelihood of?
I mean, 60 days is pretty short,
Yeah.
right?
60 days is pretty short. If they put it through with no tampering of the underwriting
Yeah,
regulations,
You keep saying that. We're going to talk about that in a second.
okay, then that's going to put us back to pre-ACA times.
Right, which is
So we're
that
going
March-
back to the future
March 20
again.
again.
Back to the
Back to the
future.
future.
Yes, yes. Watched every one of those
I
movies.
feel
They
like
were
I'm
great.
on Groundhog Day or
Uh-huh.
something here.
So, but the problem is that puts us back to a large pool of uninsured people.
Yeah.
Correct.
And I've looked and looked. I've yelled at the television long enough that my wife Coral finally said, "Why don't you do something about it?" And I wrote up a proposal. And the proposal I have is a payroll tax. It's a very significant payroll tax. It's something along the order of $200 billion a year. But in my opinion, that's what we would need in order to fund the uninsured.
Right.
We need to get out of the business of tampering with the group insurance. That's a huge portion of our healthcare expenditure every year in the United States. We need to leave that alone. We need to let that continue to go on. And the Cadillac tax, which as it is would come in a couple of years,
Right.
would do a lot to exit employers from that. But we need to address the uninsured. The ACA did not effectively address the uninsured. It shifted a lot of uninsureds around. But now if we can get back to where we have good competitive pricing and good products in the small group and individual market, we still need to figure out a way to solve the uninsured population. My proposal does it with a payroll tax.
What was the percentage of that payroll tax?
It would be 1% on the recipient of a W-2. It would be 1% on the payer of a W-2.
Okay.
With the 1099, the person that's paying the 1099 would pay 3% of that because they're not providing insurance to that person. They're paying the 1099 too. And if they're paying, they being the employer, something in a W-2 to someone that does not get insurance from them, then there'd be an additional charge for that as well. And in figuring the cost of this, I didn't include those extra amounts at all. It just seemed to me that we need some kind of incentive for employers to continue to offer group coverage.
Right.
Should pay a little bit less. Maybe we would get some of those part-time jobs coming back to be full-time if we did it this way. That would give us enough money, I believe, so that every child that doesn't have insurance through a group plan or a government plan would be able to enroll in a CHIP program. In Ohio, we have the OCHIP program.
Right.
Some of the states would have to bring their quality of their program up to date. They don't provide full coverage through that, so there'd be some adjustment there. That would cost about $22 billion. Then we would have over $170 billion left to help provide coverage for the uninsured. So if I'm a new business person that I can barely make payroll, well, my employees automatically have a bronze plan.
Right.
Benjamin Franklin had a great quote that I love, that we must make the poor uncomfortable in their situation. So let's give everybody that doesn't have coverage through a group plan a bronze plan. Not the best coverage in the world, but maybe you can scrape together the cost to meet that out-of-pocket expense. You're not going to lose everything with a $100,000 claim, and we're not going to burden society with that $100,000 claim when you show up at one of the local hospitals and you don't have any money to pay for that. That's it, kind of in a nutshell. I don't see any other alternative to this. We have this great structure that exists within the group. We have a workable individual program. If we come in with some income restrictions, which I didn't look into my proposal, that would further narrow down the availability of this. But if we find a good point at which, if you're at this % of the federal poverty level and you can't afford to buy this insurance, then it's going to be given to you for free. So if someone's making $20,000 a year, their employer's taking $200 out of their pay. Their employer's contributing $200.
Right.
There's $400 of the nest egg. But if somebody's making $100,000 or even $1 million, they're contributing much more than that.
Right.
And I really believe all of us will spend some time in that space where we need coverage. Now, timing of this is crucial. We're getting ready to have some type of tax reform, maybe some type of tax reduction.
Right.
If we can piggyback that with this change, you know, if you go to an employer and say, your rate's going from 35 to 20, but we're going to charge you a 1% on your payroll, which isn't your full cost.
Right.
Maybe that would be acceptable.
That sounds really simple.
Yes.
We're incapable of making those decisions today.
Yeah.
It does sound simple.
Because
They've proven that time and
But
again.
I completely agree with you. So one of the things is, you know, this is a problem.
Oh, yes.
And status quo is, quite frankly, it's just not an option.
No.
It just isn't. Will this work? I think it's really anybody's guess. Could it stabilize the market again? Potentially so. So one of the things that we will do is we will put this executive order out on healthierbirthdays.com.
Yep, it's 2 pages. It'd be worth taking a look at.
Also, Grant shared with us kind of a white paper written by the Actuaries Association
American Academy of Actuaries about selling across state lines.
regarding
Why that might work or might not work.
Right, across
Yeah.
state lines, because I've had a lot of calls about that.
Okay.
So we'll just keep on this subject and keep on this topic. And hey, thanks for being with us today,
It's
and I
my
appreciate
pleasure.
it. Thanks
Thanks
for
for
all your
having me.
work and all your effort and everything you do for all of us.
We
Thank you
appreciate
very
it.
much.
Thanks,
Yeah.
Grant. Join us next time.
Thanks for listening and opening your mind. If you're interested in learning more, you can reach us at scott@healthierbirthdays.com.
Or Ann at healthierbirthdays.com. We hope you'll join us next time
On Side Effects.